Hi, I'm Ashley Murphy, and I will be presenting on prevention and management of falls in older adults with chronic pain. We know that chronic pain is a worldwide issue that affects approximately 50% of older adults. Chronic musculoskeletal pain can occur in the hands, wrists, shoulders, back, chest, hips, knees, and feet, and this increases the risk for falls. In pain, falls and mobility limitations are shown to decrease the overall quality of life. So this review of literature will focus on chronic musculoskeletal pain in relation to prevention and management of falls in older adults. All studies reviewed included adults 60 and older, had the ability to demonstrate mobility by walking a certain distance without assistance. They were community-dwelling older adults and had no significant cognitive impairment. Chronic musculoskeletal pain. So we know it can cause functional decline, muscle weakness, mobility limitations, and a decrease in neuromuscular response. There is special attention to lower limb weakness, which can cause slower gait and decrease mobility and pain. It has also been found that osteoarthritis is the main disease contributing to joint pain, especially in knee pain. We also see a reflex muscle inhibition. This can be due to lack of physical activity or direct effect of pain on the muscle. We also see unstable balance. This can be due to gait alterations or adaptations and weight shifting. We also see decreased executive functioning and attention, and there can also be an increase in sedentary behaviors. Falls rank among the 10 leading causes of death in older adults in the United States. Most falls seem to occur during the year before baseline, which could be due to an over-adjustment to the chronic pain being experienced. We also see that more falls are seen in those with milder or early signs of hip osteoarthritis. Falls are positively correlated to age and the risk of death or serious injury from a fall. The odds of another fall increase once being hospitalized from a fall. Another study found that the fear of falling was the largest single factor to increase sedentary behaviors. There's an increased risk of falls with lower limb arthritis, and about 80% of falls occurred during ambulation or incline or decline on the stairs. This particular study also went more specific and found that tripping was the most common reason, followed by slipping on the stairs. So recommendations for providers. We see the multimodal approach. It's also very important with this approach to keep in mind that medication options should be consulted with a medical team to assure no overuse or underuse, which can also contribute to falls. We also want to recommend physical exercise and structured exercise, which are essential non-pharmacological approaches. But we also want to keep in mind that when increasing physical activity, it is highly recommended to consult with a physician, especially if there's cardiovascular health is a concern. There's also studies done on mind-body interventions, such as biofeedback, progressive muscle relaxation, meditation, and guided imagery. It is also studied on hypnosis, Tai Chi, and yoga, and this all has shown to decrease pain and increase mobility. Now, little research has been done with older adults for all mind-body interventions. However, this does demonstrate the feasibility in the older adult population. And lastly, we see a patient-focused discharge interventions at the hospital after a fall seem to strongly influence the participant's mindset around fall prevention behaviors. This includes social support from a partner or family member. But it's also the most important thing to remember that the patient needs to know their boundaries of what they can or cannot do. And then we have recommendations for patients. We want to remind them to participate in safe exercise and physical activity to help prevent and manage their chronic musculoskeletal pain. Remind them that they can modify home hazards to ensure a safe moving environment. Seek assistance with daily activities. And also ask about mobile technology options, because according to the CDC, mobile technology is a key intervention for healthy aging. And lastly, we must remember that knowledge equals capability, meaning equals motivation, and your circumstances equals opportunity.